This patient was a 58-year-old woman with polycystic kidney disease who was incidentally found to have 2 intracranial aneurysms. This right vertebral artery injection shows a large, broad-based basilar tip aneurysm. The other aneurysm was a middle cerebral artery aneurysm that was uneventfully coiled. For this large aneurysm, the treatment plan was to carry out partial coiling followed by placement of a pipeline flow diverter extending from the basilar artery to the right posterior cerebral artery. This strategy was adopted because the left posterior cerebral artery was known to be fetal in configuration, and the patient lived in a very remote rural area, and follow-up was going to be difficult, so I wanted to ensure that the basilar apex aneurysm did in fact go on to thrombose. This is the initial image with one catheter, a balloon catheter, from the left vertebral artery to the right posterior cerebral artery with the balloon extending across the neck of the aneurysm, and a second coiling catheter towards the end of the coiling portion of the procedure. You can see that the aneurysm is not too densely packed, and following the balloon remodeling with coil embolization, there is filling among the interstices of the coils. After the coiling, a flow diverter was placed, and this is the delivery catheter for the flow diverter extending into the right posterior cerebral artery. And this is the immediate post image following delivery of the flow diverter. This case was actually complicated in that the tip of the delivery wire could not be retrieved, having become somehow entrapped in the distal posterior cerebral artery branches, and it was ultimately broken off and left as a retained foreign body. Fortunately, the patient didn't suffer any clinical consequences of that, but was kept on the dual antiplatelet therapy with aspirin and Plavix, as you would typically do following placement of a flow diverter. We did get her to return 2 months after the coil embolization, and we see here the pre and the 2-month follow-up image showing the retained distal tip of the delivery wire with diminished flow in that branch, but again, fortunately no clinical consequences, and complete occlusion of the basilar tip aneurysm.